Now, fibroids can undergo some secondary changes of degeneration, and there are various types of degeneration. There's hyaline degeneration, calcific degeneration, cystic degeneration, there's even fatty degeneration, and rare, but it's possible, sarcomatous degeneration, which happens in less than 1% of myomas, and there's so many myomas you can imagine that you might encounter one or two in your lifetime. So that's degeneration. They can necrose, outgrow their blood supply. They can have internal hemorrhage. They can become superinfected. So take the standard myoma and superimpose these changes. Now things start to get a little bit interesting. Hyaline degeneration is the most common type of degeneration. That's actually a pathologic kind of a diagnosis. We can't really make that diagnosis from sonography. It occurs typically at the center of the tumor because of the poor blood supply, and the smooth muscle whorls are replaced by homogeneous hyaline material. They stain that pink on their slides in pathology, and the tumor just becomes kind of soft, and patient can experience a dull pain. So it's not really a sonographic diagnosis, but I am showing you one that is here pathologically proven. Tends to be a bit echogenic. So sometimes they can be hyperechoic. They can liquefy and develop cystic change on top of that, and basically are removed only based on symptoms. Now, calcific degeneration is the result of, it's a late result of vascular impairment. The fibroid becomes calcified and slowly involutes. And here are some different patterns. Here's kind of a peripheral calcification with a lot of attenuation. Here's sort of a tip of the iceberg appearance where you only see the top part with dense, strong shadowing, very few reverberations. And here a speckled kind of a pattern, the pattern of the so-called popcorn calcification. Cystic degeneration obviously shows a cystic change, again, the result of outgrowing a blood supply. And this can be a mimicker of a number of things. In this case, there was a pregnancy, and we thought there was a twin pregnancy, but it turned out that this was a cystic degeneration in a myoma, which fooled us. There's fatty degeneration. Fat is hyperechoic on sonography, and here's a couple examples of a hyperechoic change with acoustical shadowing, at least in that case. Now, there are a few types of fatty tumors in the uterus, so I want to just quickly talk about these for a second. When you see a hyperechoic mass, and you can prove it on CT that it's fat, this could be fatty degeneration in a myoma. It could be a so-called lipoleiomyoma with lipo and myo elements. It could be an actual pure lipoma. Could be a fibromyolipoma with fibrous myo and lipo elements, and myolipoma, any kind of combination that you can think of with the lipoma. A lipoleiomyoma is a rare benign tumor that contains fat. It's usually asymptomatic. It's not a surgical lesion. It does not degenerate into anything sarcomatous. It has mixtures of fat, smooth muscle, and fibrous tissue. It's highly echogenic. It attenuates sound. It kind of reminds you of what a dermoid looks like. Also reminds you of what an AML looks like in the kidney, angiomyolipoma, because that has fat in it. So there's fat with attenuation. And you can confirm this with CT or MR, and it's a benign condition, does not need to be removed. The only thing is you have to be sure that that's actually in the uterus and not, for example, an adnexal mass such as a dermoid. Here are a couple more examples. Hyperechoic mass with areas of sound attenuation. Here's another one, homogeneous hyperechoic with sound attenuation. Hyperechoic mass, Here's a more complicated one, more mixed kind of a pattern, probably has more myomatous and fibrous kind of elements inside. The worst tumor that can occur in the myometrium is the leiomyosarcoma. It's very rare. It may arise de novo, or it can arise in a pre-existing myoma. It's indistinguishable from a leiomyoma. So the only thing that we have to go on is that there's symptoms, there's pain, there's bleeding, and there's rapid growth of a mass in the uterus, and changes in a postmenopausal woman. Postmenopausal women tend to shrink their myomas. If it's a postmenopausal woman and the myoma is getting larger or the myoma is degenerating, then one has to consider the presence of a leiomyosarcoma. They're locally invasive, and of course they metastasize. This is a leiomyosarcoma that occurred in a 22-year-old woman. She was nulliparous and went to see the doctor. Her uterus was enlarged and was told she has a fibroid. She was not followed, and the fibroid kept growing and growing, and eventually she came back. Diagnosis was made of a leiomyosarcoma. This is more typical of the presentation, a 68-year-old postmenopausal woman with a kind of a mixed pattern of a fibroid that was enlarging. Close follow-up is very important in these patients. Another example here, this was a 60-some-year-old woman with bleeding and a very heterogeneous kind of mass, cystic and solid elements in the myometrium, invading now the endometrium, and this was a leiomyosarcoma. This is in the differential endometrial sarcoma. It can look very much like a leiomyosarcoma. This is an unusual situation. The tumor begins in the endometrium. And this pathology in this patient revealed a high-grade sarcoma originating in the endometrium, and it invaded completely through the wall of the myometrium. So this was very difficult. At first we thought this was going to be a leiomyosarcoma because the bulk of it looked like it was in the wall. So that's kind of, in the back of your mind, an unusual tumor to differentiate, or at least not be surprised at the final impression of the pathologist. Now, more of these changes. We talked about these up here ending with sarcomatous degenerate. Now let's talk about necrosis, hemorrhage, infection. A fibroid can become superinfected. In that case, it's called a pyomyoma. You may see, of course, the patient will have a fever and there will be tenderness, but you may see bright reflectors that shadow that look like gas, and gas is gas. You can confirm this with a CT scan showing these gas bubbles. The way the bacteria get in is usually through a submucous myoma that's prone to infection. This, if not treated, can lead to sepsis and can become an extremely difficult situation to treat. This has to be differentiated from necrosis. Now, necrosis, I've seen cases where the myoma outgrew its blood supply and actually had air or gas in it. There's some release, maybe some type of nitrogen gas, whatever, but there was no pain. I'm sorry, there was no fever. There was pain, but there was no fever. And this sometimes occurs with pregnancy when a fibroid begins to grow and may have a very similar appearance on ultrasound.